Well, I'm going to talk about the Affordable Care Act today. Some of you may refer to as Obamacare. Will you play or pay? This is a provision I'm going to try and speak to real quickly here, or whether or not you're going to participate in the employer mandate portion of the Affordable Care Act. The employer mandate is effective January 1st, 2015. We got a little bit of a reprieve. It was supposed to be January 1st, 2014 of this year. Okay. So the first thing you need to do is determine if your community is a large employer and if the employer mandate applies. To do that, you need to determine how many full-time equivalents you have. Full-time equivalents of 50 or more will be subject to the employer mandate for the Affordable Care Act. For example, this is a calculation of the 50 full-time employees. You don't just take into account your full-time, it also includes part-time hours for the calculation of FTEs. You count all your full-time employees, 30 hours or more a week, as one. So do you have more than 50 or more full-time employees or full-time equivalents? If you do not, then you don't need to worry about this portion of the Affordable Care Act, the mandate, and penalties do not apply. If you do, then we're going to talk a little bit about what happens next. Do you offer health insurance to full-time, which is 30 hours or more per week? If you do not, and at least one of your employees applies for coverage in the exchange and receives a subsidy, you're going to pay a penalty. If you do offer health care to your employees, it still has to meet a couple of affordability clauses, including, does the coverage cover at least 60% of the minimum value? If not, and any employees purchase coverage in the exchange and receives a subsidy, then again, you're going to get a penalty for not offering affordable coverage. You also have to make sure that the employee's portion is not more than 9.5% of their W-2 Box 1 wages. If it is, and that employee applies for coverage in the exchange and gets a subsidy, then you'll pay a penalty. If you've met both of those affordability clauses, you can put a big smile on your face because you've met the mandate and you won't be paying any penalties to the government for not offering affordable care or not offering health insurance. So who would be eligible for a subsidy? Many of your community workers would be. It's anyone who's below of 400% or below of the federal poverty level. For an example, for 2013, that is $45,960 for an individual. What are the penalties? If you do not offer coverage, you're going to pay a penalty on all of your full-time employees at $2,000 each, minus the first 30 employees. So for example, if you have 120 employees, let's say, your penalty is going to be 120 minus the first 30 times 2,000, so $180,000 per year that you're going to pay, not tax deductible. There also can be penalties even if you offer coverage, but it's deemed not affordable. That penalty is $3,000, but it's only charged on those full-time employees who are receiving coverage in the exchange and receiving a subsidy. However, your penalty for not offering coverage can never be more than it would have been, or excuse me, your penalty for offering coverage can never be more than it would have been if you didn't offer coverage. So there is a maximum on your penalty. And I'll show you an example here of how that will work. Let's say you have 120 full-time employees, 30% of them receive assistance in the exchange to purchase health insurance, then your penalty is going to be on those 30%. So 36 times 3,000 equals $108,000 you would be paying to the government, again, tax deductible. So if you decide to play, some things you need to keep into consideration. Your participation may increase. We expect to see rising healthcare insurance premiums. You're going to need to track employee hours for eligibility, and there are a lot of reporting requirements. If you don't play, then you're going to have penalties. You're still going to have those same reporting requirements, even if you don't offer health insurance. And you're probably going to give your employees, some of your key employees, maybe some increase in wages, and then your payroll taxes and everything's going to go up because of that. Also, if you don't play, you need to take into consideration how that's going to impact your recruiting. Is your turnover going to increase? And at the end of the day, what disruption is that going to have on your residents? So what should you do now? You should be looking very closely from a financial perspective on what the best option will be for your community. You probably want to staff up your HR because they're going to have a lot more administrative duties that they're going to have to be responsible for, and get help from the experts. We're at booth 1304, and we also have a great resource page on our website with a lot of information specific to healthcare reform and how it will impact senior living communities.